Hang low or be bigger.
I was trying to hide my facial expression when you were talking about that. I was like, oh God.
Yeah.
The first orgasm she had was when she left the parking lot of the clinic.
You know, a lot of guys want it to be bigger, longer, fatter, thicker.
I don't want anything that hurts going down there.
Hi, I'm Dr. Chris Crowley. Thanks for tuning in for today's episode of Beauty and the Brain. I'm joined by my husband and co-host, Jerry Drinkard, family nurse practitioner, and our nurse practitioner at Skin Tonic, Allie Ballew. So today we have an exciting topic and something that is taboo in many social circles, and it's sexual health. We have a lot of juicy things to share with you guys, and so we're excited. Jerry?
Yeah, today we're going to talk about several things that are just kind of shrouded in secrecy, as Chris said, and not commonly talked about. We've got Allie joining us, and she's an expert on the female side of this. She treats most of our female patients at the clinic, and we're happy to have Allie with us today.
Yeah, I'm super excited to talk about taboos of sexual health today, especially from a female perspective. It's something that we don't talk about a lot and is overlooked, but is really important.
Yeah, this is a topic that in the clinic we've all found kind of interesting, because a lot of patients don't really want to discuss this, or they won't openly bring up these topics. But as soon as they have one little gateway, so whether it's a pamphlet or a brochure or a book that we have on sexual dysfunction, we find that kind of opens the doorway and allows them to start exploring options to really help them in their personal life. We know that it's something that affects a lot of men and women, so let's just dive right in and start talking about the juicy stuff with it.
One of the most difficult things is how do you get to that point of a patient's coming in for another treatment, is how do you get to the point of discussing sexual health with them? And my gateway, and yours may be different if it is, please share. I just kind of talk about the different treatments, and PRP is commonly done in the clinic, whether for hair growth or for a vampire facial or one of the other treatments. And also at that point, that's when I introduce the O shot or the P shot, depending on who it is that I'm talking with. And most of the time, if they don't say, I've suffered from this, or they know someone that suffers from this, or they'll either call Sierra, they'll call her back later for an appointment and say, hey, you remember when I was in there the last time, we were talking about X, Y, or Z, and can you tell me more information on that? How do you bring it up to your patients?
That's definitely one of the ways, is PRP and all the different uses for PRP that I bring it up. And then I also have a book right on my top bookshelf that is in clear view of the patient that says The Female Orgasm. And if they're curious about what the book is, it's usually a very easy way to kind of start talking about that and the O shot, or what they're struggling with sexual health. So that's a pretty easy way. It's a good topic starter.
We entered this, sexual health arena more than 10 years ago, and this was actually when we took a class from Dr. Charles Runnels, who developed the P-shot and the O-shot and vampire face procedures. And when we actually took the class with him, our interest was strictly on facial procedures, and we were looking at rejuvenation. And I can remember distinctly us having a conversation and say, we're not ever going to treat anything from the neck down.
And for years we didn't. For years it was never a concern, but I think it also had a lot to do with our patient population we were treating at the time, the location. We were in a spa suites type situation, and it really wasn't set up to treat this, and lack of knowledge on our part, because we weren't comfortable and didn't know how to approach that topic. I think it's a very taboo subject to approach with some people, but once you open that door, it's surprising the statistics about how many people are affected by this, don't you think?
Yeah, and I think even more so, it's common to see commercials nowadays, not always, but now it is, about erectile dysfunction and men's sexual health, but we're still kind of behind on female sexual health. And it's not really that different in the form of statistics. Like a third of women and men both very commonly have sexual dysfunction. And so I think it's great that Now that I'm a part of the practice, I think that females are a lot more open to talking to me about it. I know even like, I don't know how it is for guys and like friends and what, you guys feel like you can talk about as a community, but I feel like women empowerment and all of these movements that have been happening and feminism, and it's a lot more common for women to feel open to talking about their sexual health and what they're happy with and what they're struggling with now more than ever.
Yeah, I think it's really like important, and I think the book that you discussed is one of the ways that we actually started. So when Dr. Reynolds wrote this book, he encourages it as part of your practice, even for the patients to be able to pick up and take out of the practice to read about these procedures without having to have that conversation. Clearly they need a conversation with a provider before they actually get a procedure, but this allows them to kind of research it and at least know that there's help out there when they're having some particular problems. And once we started kind of learning more about the procedures and becoming more comfortable with them ourselves, then I think we actually became more comfortable discussing this issues with the patients.
Well, I also think one of the misconceptions is that sexual dysfunction is erectile dysfunction, and there are so many other aspects to it. I mean, you have, stress incontinence that can occur during sex, which is horribly embarrassing for people. You have erectile dysfunction, which is the most common thing that's advertised, as you'd mentioned. Lack of sensation, the vaginal dryness for our perimenopausal, postmenopausal women, and we have several really young women now that are going through changes earlier and earlier. And so, sex is a huge part of a healthy relationship. And when it is uncomfortable or can't happen for either of the partners, or God forbid, both partners, then it really puts a strain on a relationship emotionally and physically.
I always think back to a couple that we had that came in and the wife brings the husband in and she's like, he can't maintain an erection. And then you get them alone and the husband actually says, well, I can't maintain an erection because it's painful, and complained of that sandpaper sex, which is what happens when the wife is experiencing vaginal dryness. And so you kind of learn, it's like, people don't want to talk about it, especially with their partner who you would think, it would be so easy to talk about that, but you don't want to feel like something's wrong with you. But the fact is it's just a normal function, just like, if you had kidney failure, like you wouldn't be embarrassed to tell somebody, that, oh, I have to go get dialysis. No, it's just part of your body, and all of our body functions work independently and together, so.
That kind of touches on like what we see is how many times people do protect their partner. I call it protection. I don't know that that's what the goal is, but the partner's kind of kept in the dark. We have guys that, they keep Cialis or Viagra in their truck so that their spouse doesn't know it. But, having to plan for sex also takes away that spontaneity, which is the fun part of like sex. You don't want to have to plan for it 3 or 4 hours ahead of time and take medication. And some of the treatments that are available today kind of give you that spontaneity back, don't you think?
So I think that's a good kind of transition point that for us to go into talking about male and female sexual health kind of differently, so our listeners can get an opportunity to kind of hear what's available for each sex out there. So let's start with the male sexual health. So as we mentioned earlier, we've been providing the P-shot, which is a plasma therapy or platelet-rich plasma, and it's a therapy that was developed by Dr. Reynolds for a number of years. And a few years ago, we incorporated a shockwave device into our treatment, and we've had kind of great success with this over the past few years. And I want to talk a little bit about how our practice changed with a slight marketing change. So we were doing these therapies for a long time, and they were in the erectile dysfunction category. And we found that it was really kind of difficult for guys to say they had a dysfunction, especially when it comes to anything sexually related. And as we started using this device that we're using for shockwave therapy, we use the Zimmer Z-Wave, and that device, we just kind of abbreviated it with a P-Wave, and that strictly was for our scheduling purposes, and so we knew when the machine would be in use and for what the anticipated amount of time for the procedure would be. And someone suggested that we, kind of incorporate that into a more of a entire package for erectile dysfunction. And at that point, we come up with our own trademark procedure, the Performance P-Wave, and we kind of developed that, and it's a way that we can comprehensively evaluate guys of various ages, and whether or not they have some mild dysfunction all the way up to severe dysfunction, and let them know what treatments we have available in our office that are minimally invasive, all the way up to the point that maybe they need referral out for evaluation by a specialist such as a urologist or someone with surgical skills that can evaluate them for more invasive things like a penile implant. So Jerry, what are your thoughts since we started doing the performance P-Wave at our practice?
I think saying performance improvement was the game changer for it. I mean, obviously you can't shoot pool with a rope. So one of the things that we try to do is we want to increase the stiffness of the erection, the rigidity of the erection, making the erection last longer. But sensitivity is another issue that is very common. We have a lot of high school athletes, or younger athletes, I should say, that are on performance enhancing drugs that affect them later in life and impact testosterone levels as they age. And so we're seeing a younger population, and no one in their 20s or 30s or 40s or 50s for that matter, wants to say that they have erectile dysfunction. But it'd be really hard to find a guy in their 20s, 30s, 40s, or 50s, or 60s even that says that they don't want to perform better. And so I think just changing that name to a performance rather than a dysfunction really made it a lot easier for guys to say that's what I want. And I think having a specific brand such as the Vagicadabra, which we'll talk about in a bit, but just having a name that people can ask for without saying exactly what's wrong, kind of opens the door and makes it an easier subject to talk about.
Yeah, I really think that alone, it didn't necessarily change our evaluation. So, we're still having to do a thorough medical evaluation and history and kind of evaluate what their dysfunction is, because in reality, that's what we're treating. But it certainly is a conversation starter. And by changing that name, it allows it to open that door and at least initiate that conversation. So, Allie, I know that you see most of our female patients, but they're also a major referral source for the guys in our practice.
Oh yeah, definitely. I can't tell you how many female patients I've had that's like, I'm bringing my husband in for that, or I'm bringing my boyfriend in for that. And then they tell their friends about it, surprisingly. Like, I didn't think that guys talked about it that much, but they tell their friends about it. And then it's, before you know it, you've got like a whole golf group in there, like getting P-Waves. So I think it's great though that we're getting to the point in our social circles that we can talk about it and refer people and all have great sex.
Yeah, exactly. So Jerry, do you want to share a little bit about what that process looks like? So if they're a patient or if you're a listener out there and you're trying to think, what does this actual performance P-Wave look like? Or if I'm going to be evaluated, what does it entail?
We have different degrees. The performance P-Wave is actually a combination of a couple of treatments. The sound wave device, as Chris mentioned earlier, and the P-Shot that we'll talk a little more about. The P-Wave is actually a non-invasive or minimally invasive treatment that uses sound wave device to open up those arteries and veins that can sometimes either be hardened and not fully dilate, or they can be injured from previous sexual injuries or from diseases, whether diabetes or Peyronie's disease. So a lot of times the P-Wave can open up those and actually help with even without the need for the P-Shot. We typically do 6 treatments on these patients with the P-Wave device, and then we have the P-Shot, which we're able to offer, and the P-Shot is a plasma treatment where we draw 60 cc's of blood sample from patients, process it in a dual spin system, and then we re-inject the plasma component into the penis to help with better improvement for erections and sensitivity.
Yeah, there you go. These procedures, they do involve some home care as well, right? So we usually combine that with things like a vacuum assist device. It's something that we send home with the patient to do vacuum therapy for twice a day, 10 minutes. It's pretty easy, and something they can do at home to maintain the results they're paying for in the practice. And sometimes they need some medications along with it. And so we kind of evaluate that on a case-by-case basis and decide if they need any kind of medical therapy along with the device.
The other thing, kind of like in skincare, when we talk about like a good skincare regimen being insurance for, maintaining your neuromodulator, your fillers, you also have some homework to do with these sexual health treatments. It doesn't work well in smokers. We encourage smokers for smoking cessation, weight loss in our obese patients, getting your A1C down in your diabetic patients, exercise for your patients that aren't moving around. All of these things are things that impact overall well-being, but certainly sexual well-being. And typically, if we start patients and we tell them to walk a mile a day, that's 5 miles in a week. And a lot of these people, if you say anybody can walk a mile in a day, right? And not necessarily. I mean, we have some of these guys that have been pretty stable, not moving around much for several years. And so if we give them a goal, it's really nice. It's doctor's orders. Basically, you go home and you need to walk, you need to lose a little weight, you need to vacuum a couple of times a day for the first 30 days after the treatment. And when they start seeing results, we can ask patients 6 months out and they're still using the vacuum pump or coming back in for a follow-up treatment. So it's really good to see when you make a difference in these people's lives, because it not only impacts theirs, but also their spouse or their significant other.
So, Allie, have you seen any of our female patients or the female partners of the guys who've been receiving the P-Waves?
Definitely. They're like, we're doing it more because it builds the guy's confidence up a lot, I think. And sometimes not like before you would even actually start experiencing benefits from it, like physically benefits. And so just by them having that procedure done, sometimes I think just like gives them that confidence that like, oh, I know, because a lot of it's mental. It doesn't have to be mental, but some of it is. And so I think sometimes just like stepping in the right direction and doing something about it, they're like, okay, I'm going to start seeing benefits. This is going to be good. This is going to be good for my marriage, for my sex life, for whatever. And then immediately they start to see benefits, maybe not just from the device, but because they know they're being proactive about their sex life.
I think also you brought up a good point about like you want confidence when you're with the person that you love or the person that you're with. And if erectile dysfunction ever happens once to a guy, then there's always the next time that it's in the back of your head, is it going to happen again? And if it happens again, then it's just even more deeply rooted. And so something that I ask every single guy that sits in my chair for a sexual consult is, do you wake up with a morning erection? Do you get hard during the night? And do you masturbate? And so typically if people can answer yes to those questions, then there's some sort of mental block or some anxiety around having sex that's causing the inability to perform like they want. And so, and we see the same thing with maintaining an erection. So if a guy, can get hard originally, but he loses an erection during sex, chances are the next time when he gets about to that point when he lost that erection the last time, it's going to be in his mind, like, is it going to happen? Is it going to happen? And when you focus on that, then it happens. Yeah. And so then we have something completely different to delve into. But I do think it makes guys feel good to know that, if you can masturbate and you wake up with erections, then like there's not a physical problem with you. Like, this is something we can get by and it's going to be a pretty easy fix for you. And so those questions that seem so uncomfortable really bring comfort to people.
Yeah, and I think it's important if you're treating these patients in your practice, or if you're one of our patients listening, that also a lot of things that we can do help with some of the physical problems, but if there is some kind of psychological component that goes along with it, that you're not embarrassed to talk about it or seek help. And so there are a number of therapists available, and we have so many great therapy things that's available online now or through apps on the phone that certainly can help you with some of these psychological problems that may be contributing to that. So let's jump to the other topic real quick and talk about our Vagicadabra. So Vagicadabra is the newest thing we're opening. And yeah, we all kind of get a laugh at that.
The hottest thing on the market right now.
Hottest thing on the market right now is the Vagicadabra. And so, Allie, tell us about the Vagicadabra.
Yeah, so the Vagicadabra is a CO2 laser, actually, a wand, if you will. And so this vaginal probe is actually, inserted in the vagina, and lasers the inside, does some resurfacing, and helps with stress incontinence, with resurfacing the inside, which can help with like sandpaper sex, vaginal lubrication, creating your own natural vaginal lubrication. And we've seen really great results with it. And the best part is that it doesn't hurt. There's a little bit of, you can feel something happening like right at the end of the procedure, but I haven't had anybody that's like, I would never do that again. So that's always comforting to hear, because I think that's a very scary thing. When you talk about a sexual health procedure, like you're like, I don't want anything that hurts going down there.
And especially anyone that's ever had a CO2 on their face. I mean,
yeah.
It's one of the most uncomfortable treatments, in
Absolutely.
my opinion, that you can do. And so you really don't think, but women tend to tolerate it, right?
They tolerate it just fine. I mean, we're sitting there talking about what they're going to eat for lunch or what they bought shopping last night online at Amazon at 2 a.m. It's not something there's a lot of anxiety around, especially once I talk to them and explain to them it's not going to hurt, and I promise it's not going to hurt. Then they're like, okay, we'll see. And then when they see that it doesn't hurt, then they tell their friends about it. That's really great.
Yeah, I was absolutely, amazed actually the first time that we did it. We did training on it. And so, before we were fortunate enough to have you join the practice, Jerry and I, we did all these treatments ourselves. And we had some patients that, did say, like, basically, we're comfortable with you guys. We've seen you for 8 or 9 years, and they still wanted us to do it. And I think some of them had seen us so long, they felt almost like friends with us, and they really didn't want us doing their procedure. So I think it definitely helps having you join us. And so certainly that's brought a whole different population in and gives our female patients some comfort with what they're having to have done. But we were there for the training on this, and we kind of, we obviously had to know how to do this procedure, and I was amazed.
Oh,
like I thought they're going to be off the table compared to what we've done for the face.
I wasn't volunteering to have it done. That's for sure.
You weren't going to do the training. You're like, nope, not going to be me.
No, not going to be me. But no, I mean, now after seeing it, I would do it and not think anything of it, which is great.
And the patients come back and consistently tell us that really, so compared to even, O-shots, which we numb for, and really, even the O-shot's not that uncomfortable, but, relatively speaking, this seems to be a pretty pain-free option with that for if we're going down the laser route. Let's talk a little bit about the O-shot. So that's the, kind of our female equivalent, if you will, of what we talked about earlier with the P-shot. So you want to talk us a little bit about how we do that?
So now that we're doing the Vagicadabra, I do really, love that. There's pros and cons to every treatment. The con, to the Vagicadabra is you've got to be willing to come back and do a 3 series of it, 30 days apart each. Whereas the O-shot can be a one and done if depending on your results, and everybody's obviously going to be different because it's dependent on your plasma and your growth factors and everything. But that's a good thing about the O-shot. Also, with the clitoral injection, you're going to get enhanced growth factors in your clitoris, which is going to heighten your sensitivity and possibly make it easier for you to orgasm. And so if that's more of my client's concern is, I'm not having a good time having sex, or, clitoral stimulation is not interesting to me, then let's go the O-shot route. And there's absolutely no downtime either with the O-shot. They can go home and have sex that night. Whereas with the Vagicadabra, you do want to have 3 days of the vaginal rest, no insertion of penises or tampons.
You probably just made a few people squeamish when you talked about the clitoral shot.
That's how I got all my TikTok views on that O-shot video, was because I said the C word.
Not just the C word, but the pain associated, because it's kind of like it's kind of the same thing with the guys when we talk about the location of the injections, and that one of the injections goes just in the ridge of the glands, and you talk about putting a needle in the head of a guy's business, and it's like,
get away from me.
So what about the females? How do they tolerate it, and what do you do to help them as far as comfort with the O-shot? Yeah,
girls are tough, man. We do topical numbing inside the vagina as well as on the clitoris. And then after we let that sit for about 15-20 minutes while we're spinning the blood and preparing the plasma, we do a lidocaine injection to do a kind of a clitoral block, essentially is what it is. And so there's a little, baby pinch, a little sting from the lidocaine. And after that, when I inject the plasma into the clitoris, honestly, they don't even know anything's happened.
When can women expect to see results if they get either of these procedures?
I would say about 4 to 6 weeks is when you can start experiencing results. Some people will have results the first night from the O shot, and that's usually because of an enlarged clitoris from the plasma injection. But yeah, about 4 to 6 weeks is when you start to see results from any type of collagen stimulating or growth factor procedure.
We had, when we first started doing this treatment, a patient said the first orgasm she had was when she left the parking lot of the clinic. So,
Yeah.
so some of those things are related to, you know, the immediate volume that you place in the clit. But the thing that we probably hear most common that they see immediate results from is the relief of stress and incontinence.
I was going to say, with the Vagicadabra now, we did have a girl who immediately the next day was like, you know, I had like a coughing fit or a sneezing fit or whatever it was, and fully expected to have a dribble and did not have to change her underwear once that day. So that's great.
Yeah. So do you think that's just from maybe the swelling right after the procedure? Did that, I didn't talk to that patient, but did she say that kind of went back to baseline?
It maintained.
It maintained, okay.
Yeah, for that patient, and obviously everybody's different,
Yeah.
but, and it could be from swelling, but for that patient,
For it
did
to maintain,
yeah.
then that would be, that's interesting.
Yeah, absolutely.
So with you may have said this earlier, but with the Vagicadabra, that is a series of 3 treatments, 30 days apart. And I think you did touch on that, but I just wanted to reiterate it. With the P shot for the guys, it's kind of like the O shot. It's very patient specific, and so, you know, some people, they do need follow-up treatments. Some people literally need that extra boost of confidence. And so, you know, if that's something that we can get them in and if we can do a treatment in a single day and send somebody home or to a swingers resort, which we frequently do, if we can do that, then I feel like my job is done, and done like better than most people can go home at the end of the day and say.
So let's as long as we're talking about kind of things that a lot of people don't like to mention, let's talk about penis size. So, right, we have a lot of women who want their guys to
My
be
favorite thing to
bigger.
talk
Your
about.
favorite thing to talk about, Allie, penis size. And, you know, a lot of guys want it to be bigger, longer, fatter, thicker. So when guys,
a hot dog down a hallway.
when guys come in that are looking for those sorts of things, you know, do we have treatment options for them? Jared, I'm going to let you answer that.
I'll start with the P wave since it is the least invasive, and most guys do report increase in vascularity, which is like pretty readily like visible, but they see an increase in vascularity, which guys like, and they also see an increase in girth. I think it's a lot harder, and we never promise our patients increase in length, but with the P shot and the Performance P wave, people do get an increase in length, but I truly think that it's because they're not fully getting hard beforehand. You know, when you take a guy, he can still have sex, but he's getting like probably 75% as hard as he potentially could, and you get him up to that 90% range, then there's going to be an increase in size and girth. There are other things out on the market as well now, as we mentioned in one of the other podcast episodes about penile filler, and you know, there are risks associated with all of these treatments. And I will say that the Performance P wave, the P shot, and the P wave alone are the safest when you start delving into that.
Yeah, so I mean, we do get asked actually fairly often about penile filler, and so when we're considering that, this is using one of the fillers that we would use in other parts of the body, but instead we're going to spread it around the penis, and that's basically to increase girth. And I think, you know, patients, we in our office do a very thorough consultation, and we kind of pride ourselves on fully explaining risk and letting patients know that they could get a vascular occlusion, which could actually cause, you know, worsening dysfunction, even death of tissue, some sloughing off. And so we don't, you know, do tons of that without kind of really talking to the patient thoroughly first. But the other things I was wanting to touch on a little bit is what about using Botox or Dysport or any of those agents? Because, you know, that's some of the things that are out there now. And, you know, we have a procedure called Bocox. And so that also was trademarked by Dr. Runnels. And that's where we're using one of the neurotoxins for penile enhancement.
I think that originally that was to make someone that's a grower and not a shower feel more comfortable when they don't have their clothes on, because it does make the penis just hang more freely when it's in a flaccid state. But there are also studies that support using neuromodulators for erectile dysfunction. And so it's kind of a win-win. You know, if you look better when you're naked and flaccid, and you can get harder when you're ready to perform, then why not get a little Botox? I mean, it's easy. It's a treatment that takes 15 minutes in the office, is relatively safe. There's no downtime associated with it. You can go out and have fun. You know, you need a 24 hours of rest, but outside of that, you're pretty much ready to go. And then just like when you're using neurotoxin in other parts of the body, it's somewhere around 5 days. And so 7 days you start seeing changes, and continue to change up to 21 days. I think that Botox is a flashy name. I hate that Dr. Ronalds came up with it instead of me, but I like it. So.
Yeah. Now, the other areas that we can inject it, you know, talking about sexual health. So there are, if you're having issues with vaginal tightness, there are select ways that we can inject to kind of relax that if it's painful for that reason. We can also inject it in the scrotum. And so it's one of the things, you know, I think we kind of laugh and joke about it and think about like smoothing out the wrinkles in the scrotum. But you know, a lot of people want that because they want the scrotum to hang lower. And so is that something that your girlfriends find important, Allie, that you girls talk about? No, you could care less. That's a guy thing.
I don't want to see balls.
You don't want to see it at all. Yeah, I don't really know that area, but I know that, you know, a lot of the guys, they want them to like hang low or be bigger.
I was like trying to hide my facial expression when you were talking about that. I was like, oh God.
Yeah.
But if that's important to you and if it makes you more confident when you're having sex, you should do it.
Yeah, exactly. So we do have, you know, quite a few options, as you guys can see, and treatments that we can provide. If you're interested in more information on anything that we've talked about on today's episode, please check out our website at skinandtonic.pro, or you can find us on any of our social media channels that we'll include in a link down below.
And keep in mind, there's no shame in talking about your sexual game. I mean, everybody wants to be better, or if you're the best, then you want to stay the best. So keep in mind, there's things out there for maintenance and improvement.
Okay. Thanks for joining us today, Allie. You guys tune in next week for another episode of Beauty in the Brain.